he said, right, just check this out. And they said, well, I haven't got a VR headset. Straight away, they're out. Or, oh, okay, check it out. You've got to download an app. Oh, which is it in this app store? Do I need to install that? Do I need to give permissions? All that kind of stuff. People have got a lot of apathy around that typically, especially if it's like a quick demo that you want to show them, or they're not like super tech savvy. You give them a URL and they're much more likely to engage with it. So this technology is really brilliant to get people up and running, get them into the experience really, really quickly. And it's getting better all the time. So, you know, it's awesome at the moment, and there's some great things that you can Google and find out yourselves after this presentation. But you know, it's getting better all the time. Oh, and the sort of the final sort of main thing is, it's basically a website, so you can push updates instantly, and they're updated instantly. So it's pretty cool. So that all sounds great, but you're probably asking, so what does that look like? Well, it probably looks like most of the experiences you've already seen in AR and VR. These are kind of some of the things that we've created. So some of them are to do with healthcare, and some of them are not. This one specifically is just showing some wind turbines, so it's just showing how well it's anchored in the environment. This is just our offices in Hessel, so you can see it's kind of all the lighting and everything works really well, and it tracks really, really well. So it's pretty good. And we've got, so this is for healthcare. So this is for one of our clients. They specifically wanted to show a condition that affects like the fat deposits on the body, and with this specific condition. And it's great to see this in AR. And again, you can just kind of fire this up, and it's a full kind of web app that works. And again, it tracks really, really well. And you can examine all the specific points on the body, you know, kind of like the veins on the legs, or like the fat distribution, and just really see how it affects a patient. And this is all animated, and this is part of a series of animations to show different patient conditions. So it's really handy for clinicians to see rare diseases like this kind of in person, which you wouldn't normally get. Again, all working through the web. Final sort of example would be this thing that we made for. So this was when the technology first came out, actually, the beginning of COVID. So when people were really frustrated with COVID, as we all still are. This was like a sort of like a really quick game where you could kind of go in and squash the little COVID thing. So you're tapping this on the screen, and as you can see, it's like got a full sort of UI and interface, and it's fully interactive. So WebXR doesn't need to be a passive experience where you're just seeing something on the screen, or rotating around a model. You know, you can build full apps, games, whatever you want in that sort of setup. So how else can it be used in healthcare? So one of the things that I'll probably show you really quickly is we've developed a platform which is really useful for collaboration within the current crisis, and just going forward in general. So you essentially log in and you create an avatar. And this is really cool because a lot of people on these presentations have been talking about collaboration, how we can collaborate best together. And this is a tool we've built out that kind of does just that. So again, all working on the web, and this is just kind of promote like our sort of Clay 10 digital health offering that we do in terms of our communications. But it's all avatar based, so you wander around, and this works on a mobile device or whatever. As you can see, other people are wandering around as well. You can do full presentations on this back screen, have hundreds of people presenting. So here we've kind of got a colleague of mine, so you can start a video chat with them if they're not running away. They might start talking to me. This may or may not work, just because we're doing video conferencing within video conferencing. So that's me. Is Chrissy going to be on as well? She may or may not be. Hi, Chrissy. Probably not sharing your screen. You're presenting to like thousands of people right now, so don't swear. No, you're not really. I'm really joking. I'll leave Chrissy to it anyway. But yeah, this is our platform, and as I say, you can have hundreds of people in here. There's some really cool stuff in this that I'm sort of running out of time to show you, but it's all about collaboration, and there's interactive tools where you can share 3D models and all that kind of stuff, and it's pretty amazing. So finally, where is it heading? So WebXR, at the moment, it works on WebGL, which is kind of a bit of an old technology. So it's going to work on WebGPU, which is like the native instruction set. So it's going to be much faster in the future. They're extending the APIs to AR Core and AR Kit. Obviously, you probably know they're Google and Apple's setup. So they're going to be really, really good, the integration with those. So generally, it's going to be faster, more immersive, more accessible with more features. And we kind of think that it probably is the future of this kind of technology because there are really no barriers to entry, and anyone can access it at any time. So it's pretty exciting. So that's kind of the end of my presentation. I did quite well. I think I did it in 8 minutes. I kind of raced through it a little bit, but that's not a bad thing. I mean, feel free to ask me any questions if we've got time, but if not, my contact details are here. I think the slides are being shared. Get in contact with us anytime.
Yeah, that's fantastic. Brilliant timekeeping as well. Thank you, Lou. Right, so we'll move on quickly. So the next company we've got is Lampada, and that's going to be Nick Dale. Hello, Nick.
Hello.
Yeah, that's better. I'm going to say you're muted. Do you want to share your presentation and take the stage?
Is that sharing okay?
Yeah, it's coming up.
There we go. Is that coming up okay?
Yeah, that's perfect.
Okay, thank you for inviting us here today. So it's so I'm just going to talk a little bit about Lampada. So I'm Nick Dale. I'm a product manager within Lampada, and we provide software solutions for AR, VR, but also other sectors as well, which cross over. So what I'm going to do today is just talk to you a little bit about what we do and just show you some examples of some of the solutions that we've put together as well. So so first of all, yeah, we do provide software solutions, but we're not just a software company. We're a subsidiary that's owned by the University of Hull. So really what we do is we look at commercializing IP that comes out of the university in all shapes and sizes. So it's quite unique in that we can kind of work with customers and organizations, and as well as the expertise that they bring in their own sectors, we can complement that with expertise and talent from within the university. So from that perspective, we think we're quite sort of quite unique. There are other organizations, but it's quite a unique partnership that we can create with customers. So we tend to kind of have kind of three core markets. The first one is emergency services, where we basically provide software solutions for predominantly the fire services, and that is mission critical software. So it kind of works really well because we can kind of bring some of the traditional functionality of that the fire services need, but we can back it up with the innovative solutions that we can develop with the help of the university as well. So we do quite a bit of work with the fire services. We have an education and training, which is learning and immersive experiences, which is really where our kind of VR and AR capabilities sit. So we do quite a lot of training, but as you'll see with some of the customers we work with, everybody is looking at how they can use VR in their organizations as well as just education and training. Obviously there's health and there's all sorts of opportunities arising these days from VR and AR. And our third market is kind of our more to do with kind of the talent that comes out of the university, but we can work with kind of mid to large enterprises just around kind of offering kind of that full IT digital solutions. So that's really just leveraging the talent that we have, and that's generally kind of bolstering development teams or just taking on ad hoc project work. And to complement those are the kind of the three propositions that we have. Intelligent response is our mission critical software, and predominantly that's a lot of that's around mobilization and risk management. Our learning and immersive experiences is where our AR and VR capabilities sit. You know, and really kind of we do quite a lot of learning, but we do quite a lot of health as well. You know, and it's all about creating those memorable immersive experiences to provide kind of you know, to help with those training and learning courses that we support. And then we've got our digital outcomes, which again is kind of more of our bespoke digital kind of transformational solutions, which again kind of could be any sort of ad hoc project that we can take on. And these are just some of the customers that we've done work for, and I'm not gonna hang around this slide long, but I think the interesting thing about this is a lot of these customers, when we kind of look at this, whilst you'll see kind of fire and rescue and health and private sector, if you're local to the Hull area, you'll see kind of some organisations you might know there in terms of KCOM and ARCA, but when you actually look at all of those organisations, they're all looking at what they can do with VR and AR today. We've done work with KCOM and ARCA on VR. We're starting to do more work with the fire and rescue services. So it really is a growing market, and you know, kind of I think we're only just really touching the limits of what we can do with VR, and I think health is another great opportunity where it could really provide some benefits. And again, just leveraging the university, some of the opportunities that we can kind of provide is with some of the so this is just some of the areas that we have within the university. So we have something we call the Hive, which is our kind of VR and AR kind of environments. You can see in the bottom right hand corner there, we've got 360 environments. We've got you know, we've got the walking equipment, and we can really test kind of different applications. So it's really good from a kind of an R&D perspective. You know, we just bring new ideas and just see what the art of the possible is using some of this technology. And in the right hand corner, you'll see kind of the Aura Innovation Centre, which is the new building on Bridgehead, which is really developed around R&D around green technology. So lots of really interesting things in there. So again, kind of that VR and AR, you know, kind of it's really, you know, why use it? You know, kind of certainly in kind of those learning and training experiences, you know, kind of the quality of learning is improved significantly. You know, we're seeing kind of 75 to 90% increased retention of course material when you actually put people through, or not just a complete VR, but when you include VR within the actual curriculum. And that's where we do kind of quite a lot of work. It's not just about a single VR course. It kind of, we're using VR as alongside the standard course material, just to help people kind of retain the information and experience it. And we certainly see a lot of that where we're kind of using VR in high risk situations. So we do quite a lot of working at heights organizations, confined spaces, where you can really kind of you can let the students kind of experience the you know, the risks, but in a safe environment. And just moving on to kind of one of the things that we created for one of our, for the Department of Psychology, which I'll show you a short video of, is a virtual brain, and really this was just to provide a more immersive and memorable learning experience. You know, rather than just looking at the plastic brains, we used HoloLens and augmented reality to provide a kind of equivalent image that the students could look at. And I'll just show you a short video of that if I can. Hopefully it works, and the images come through okay. It's just a short video of the brain in action. Okay. How are we doing, Joanne, for time? Are we?
Sorry, I'm just about to interject. We are sort of out of time really for this one, so I don't know if you can just.
I was just looking at my time. I was just looking at the clock, and it seemed like a natural place to finish. So the other one was just around a connected firefighter that we did as well, which I won't show the video for, but you know, we've got these within the slides, and again, kind of you know, I'm sure the slides will be going
Yeah,
out.
we will be sharing the slides afterwards, and any questions that people have, if they put them in the chat, we will follow them up as well. So yeah, if anybody does have any questions, they can just pop them in the chat, and they will get a copy of the slides afterwards. That's fantastic. Thank you. So next up, we've got Beta Jester, and that would be Adam. So Adam Boyne, who's the co-director. Are you there, Adam? Ah, you're there. I think you're. Are you muted? I can't hear you.
Around with my mic.
Yes. Your lips are moving, but I can't hear anything coming out. Oh. It's not actually showing you as being on mute, so I don't know what it's doing. Because you clearly are.
Oh,
we have sound.
hear me again now.
Yeah, got you. Have you
got... Fantastic. Oh God. me and Teams just don't get on the best of days, I'm afraid. Right, put that back on. I'm assuming it's accidentally closed that. If I bring this back up.
Yeah, you might have to fire through this one because we obviously that's just eating into your time a bit.
Can you see my slides?
Yeah, I've got it.
Excellent. Right, I'm going to smash through this very quickly. Don't worry, there's not much. A lot of the stuff I was going to talk about has been covered already, so don't worry too much. Hello, everyone. My name is Adam. I'm the head of technology at Beta Jester. We are an immersive content company based in Hull. So we do everything around building your virtual reality environments, 360 videos, all that kind of fun content that you've been hearing talk about today. We're the kind of company that you'd call up to get it made for you. So I wanted to talk, I'll skip over the introduction just to give you an idea. I wanted to talk very briefly about some of the new stuff that you've seen a lot of images of classic VR and things today that are available. Obviously, we've heard some talk about WebXR and some of the other cool tech. 3 quick things that you may not have seen before. Wireless VR, so your image of VR may be big clunky headsets that are plugged into big expensive computers. That's no longer the case with the Oculus Quest headset. You can now have wireless VR, so you can, it's like 3 times cheaper than buying a VR PC. You can have it on your head. You can put it on. I've got one behind me at the minute. It's just sat on there so that if I need to access something, I can just pop it on, and there we go. I'm in a virtual environment. Your hands, you can now get your hands inside virtual reality. So no more messing around with controllers, trying to explain to someone where the thumbstick is or the X button or wherever it may be. You can now just put your hands straight in, be able to open doors, pick up boxes, move things, press buttons, all the stuff that you can do in the real world. And finally, AR technology, especially in the last year, we moved on very quickly. High-end devices now use a special type of AR called LiDAR, which basically means we can use really, really accurate things, which allowed a company like Snapchat to take over Carnaby Street in London and project images all down the street so that people could have a go at this stuff with each other, seeing things in the real world. So 2021, hopefully going to be the year of the immersive technology. These are some of the new things available. But let's also talk quickly about some of the things that have changed recently. It's now cheaper to develop in VR. Cost of development gone down, modeling have gone down, all the systems have gone down. Now is a perfect time to sort of break into this industry and see what you can do, even if just to test and prototype things. Making digital twins. So you may have heard this expression before. If not, a digital twin is just a digital copy of something that exists in the real world. So we're talking complex equipment, things with levers and buttons. Is now much easier to recreate them in a virtual environment. Things like plugging CAD drawings into virtual environments, all this kind of thing, definitely possible in 2021. And then finally, remote first. As you might imagine, we're moving into a bit more of a remote first industry. VR technology and AR technology allows you to take things that could otherwise be inaccessible and bring them into people's homes so they can try it for themselves. So let me have a quick talk about some of the examples of these things in the modern day, things that you can go out and experience right now. These are just 2 examples of things that we've done here at Beta Jester. On the left, you've got Inundation Street, which is a 360 VR video prepared for YouTube, which has now had over 1.3 million views, teaching people about flash flood preparedness. You know, in the past, if you wanted to learn about a flash flood, it's all sort of very theoretical. You know, people don't know what a flash flood is actually like. The water can come in under an hour from nothing to flooded, and being prepared for that inevitability in towns where that is possible is really important. On the right, you've got the Tide of Humber, a video released early this year, which uses real maps that were drawn up in the 1600s to recreate Hull as it would have been in the 1640s, and to hear a poem from poet laureate of the time, Andrew Marvell. These are all things that can now be done with this kind of technology, allowing people to bring you into these places that otherwise be unable to visit. Other technology that we've sort of been working on more recently as well. Immersive training, obviously, has been talked about quite a lot today. Very, very important, being able to sort of experience the things that you would otherwise have been able to in a workshop, or accessing these sort of high-end technologies, things that it would be great to go into the workplace to do, now possible via a VR headset. Now, you've seen some studies sort of spoken by other people earlier today. We've seen studies ourselves, over 80% retention, even a year after you've been taught in a VR scenario, people are retaining the information 80% better than those who may have to end up on refresher courses and expensive training days. And equally, 43% reduction in injury rates, which kind of makes sense, doesn't it? It's hard to be hurt by a physical drill. It's much easier to be hurt by a real one. Equally, mobile AR coming along leaps and bounds, things like being able to identify things for a medical scenario, training people in scenarios where they can test and repeat and do it as many times as they needed to until they understand the information. People are able to test things at their own pace, at their own time, something that we just simply can't afford to do in the real world, but in the virtual space is much more possible. So, very quick summary on this very quick presentation. Possibilities keep evolving. Every day, basically, we're hearing new breakthroughs in immersive technology, things that you can take advantage of now. I mean, did you think that wireless VR with your hands was going to be available a year ago? I certainly didn't think so, but we're now in that space where that is entirely possible. High-end devices can now give you access to accurate augmented reality that allows you to explore all the kind of possibilities you hoped were possible in the past. You can remake your existing scenarios. You don't have to reinvent the wheel. Things like taking your existing training, your existing workshops and setups, team building exercise. You can commission companies to build those things in VR for you, so you know what you're dealing with, introduce people to it, and it makes the whole process easier. Now, I know this is a very quick presentation, a bit of a fly through of sort of the possibilities, but you've seen a couple of examples of sort of things that we work with. If you're interested in speaking to me more or asking me questions about the future of VR and things that have come across in the last few years, please do feel free to shoot me an email at inquiries@beta.co.uk. Thank you for your time.
That was fabulous, Adam. Yeah, brilliant, thank you. Okay, so our last presentation is from Spatial. So I'm expecting Bry Scully. Are you there, Bry? Have we got Bri? Are you there? Can't actually see Bri on the call, which is a little bit worrying. So let me see if anybody knows where she's disappeared to. Sorry, apologies. Just bear with us. I don't know what's happened to the final presentation. I'm going to see if anybody can locate the speaker. I don't think we've got anybody from Spatial on here for some bizarre reason. So I don't know if you want to flick back to the main room. So I don't think we're going to get the final presentation, unfortunately.
Can I just check? Can somebody let us back into the main room if possible?
Sorry, I think if you click on leave on this one, it takes you back in. That's what we've been, that's as I understand it.
You may have it available.
Or you could just switch screens.
You may have a button that says resume somewhere, which is what I accidentally clicked when I left.
Yeah, I think you need to switch screens though to do that.
I think what may work is going to the email that had the list with links and moving through that.
Hi, Hanan, are you in this room?